Thank you, co-chairs Darling and Nygren, and esteemed members of the Joint Finance Committee. Hey, when you're asking for $200 million, whatever it takes. So you have my testimony in front of you, and I'm only going to read one line from it. I'm going to let you read the rest, but you shouldn't get all happy because I'm only going to read one line. That doesn't mean I'm not going to sit here and talk for a while. So I'm going to read you my first line that I think is very important when we talk about healthcare in no matter what instance. And that line is, healthcare is personal and it is local. Once again, healthcare is personal and it is local. Let's talk about the personal part. I have a family of 4 with 2 teen daughters in their late teens. What I'm looking for in healthcare is different than maybe someone else on this committee who has a couple of young children in their family. Or it may be different than someone else on the committee whose kids are gone and they're getting close to retirement. So when it comes to healthcare, healthcare is a personal decision that people look at for their own individual circumstances. And healthcare is local. What I may want for healthcare in my rural Wisconsin district may be different than what the healthcare market is in the city of Milwaukee, or maybe different than what it is up in Hayward. Yes, there's always going to be certain instances that are universal across, but healthcare is local. So when we look at healthcare right now, if it's local and personal, how is it being maintained? By a bunch of politicians on both sides of the aisle in Washington, D.C., 1,000 miles away, making decisions on what's going to happen here in the state of Wisconsin. And you know what? I don't care if you're on the left or you're on the right. It isn't working right now. So what we have to do is we have to look at the current Affordable Care Act and what options do we have as state legislators to see what we can do to make healthcare the best for our constituents that we represent. And that's one of the reasons we come forward with the Wisconsin Healthcare Stability Plan today. And what that plan does is ask for a 1332 waivers. 1332 waivers were allowed in the Affordable Care Act starting January 1st of 2017. And what they state is sometimes known as the state innovative waiver, which means the state has some ability to make changes. It states 3 things must happen in that 1332 waiver. First, the waiver provides insurance coverage that is at least as comprehensive as the current coverage. Second, the waiver will cover a comparable number of individuals. And thirdly, the waiver does not increase the federal deficit. Now let's look at, we cannot change the Affordable Care Act at our state level, but we can put forward a 1332 waiver. So I'm going to go through a simple scenario here. And it goes back to healthcare is local. So in the state of Wisconsin, under the Affordable Care Act, there's 16 different local regions to score healthcare. So let's take someone who's 21. If you're in Dane County region, their healthcare costs approximately $350 a month for a single 21-year-old. If you're in Milwaukee area, it's about $450. And if you're up in Brown County, it's approximately $650. So let's do a little, we called it in the Navy all the time on the submarine, a little mental gym to keep our brains going here. Let's pick the person that is a single person in Milwaukee. Now, when you look at the Affordable Care Act, you look at what's called the factor of 3. So if the person's 21 and their health care cost is $450, it triples by the time they reach the age of 64. So let's take a family of 4 with a couple of kids, both mom and dad are age 40. So that means if it's $450 when they're 21, they're not 64, it would be $1,200 or $1,350. It's going to land right around $800 a month for the mom and another $800 a month for the father for health care. Add in a couple of kids on the individual market, and that family of 4 is looking at paying somewhere between $1,700 and $2,000 a month for an insurance premium, okay? Now let's say that family of 4 has a combined family income somewhere in the $60,000 to $70,000 range. The way the Affordable Care Act is set up is that the max you pay is based on your total income. So if the premium goes to $3,000 or the premium drops to $1,500, it isn't going to matter to that family of 4 because their max out of pocket is based on their gross income. So if you look at the actuarials run by doing a reinsurance market with a 1332 waiver in the state of Wisconsin, it shows that premiums will lower approximately 13% in 2019. Let's round that off a little bit. Let's say it's going to lower to 10% so we can keep the numbers simple. So you take that $2,000 premium and you lower it 10%, and that's a $200 savings. $200 times 200,000 people is about $40 million. $40 million a month times 12 months is about $480 million. We're going to invest $200 million and have the possible, and I'll elaborate on that here shortly, the possibility of saving $480 million or a net difference of $280 million. But we're never going to see that full $280 million because we're taking some generalizations here. We're assuming that all the parents on the program are 40. We're all assuming they have 2 kids. If you look at how the individual market's set up, when we say there's 216,000 people on that market, we're talking belly buttons. So a family of 4 is 4 of the 216,000. Some people on there are going to be single, and they're going to be maybe down at that $450 range, where 20% of theirs is going to be $80. Some are going to be seniors, but across the board, this can save money for the state of Wisconsin. But what it also does on top of that is it also puts stability into the markets. So there's 3 ways you can do reinsurance. You can do conditional, you can do catastrophic, or you can do a corridor method. So conditional would be you set specific risks, and if those risks occur, the state will pay. You can do catastrophic, saying anything above a certain level, we're going to cover. Or you can do a corridor, and that's how this bill's set up. And the corridor's set up that insurance companies will get a reimbursement between $50,000 and $250,000 of an entire family's health care bill. So that sets a corridor. So anything under $50,000, the insurance company is completely responsible to pick up. Above $250,000, the insurance company picks up that too. So you set the corridor in there, and the way this bill is written is the corridor is currently set up such that a $50 million investment by the state of Wisconsin will allow about an 8.8 or 80% coverage of everyone who falls in that corridor on the current individual market. And if you look at the actuarials, that will have about a 13% decrease in the premiums this year. So if you look going into 2019, currently it's estimated to increase 15%. We could see premiums, instead of increasing again 15% next year, maybe decreasing to around 2%. The year after that, it's supposed to, way out looking at it, increase about 11%. If we could lower it again another 13%, we could actually see a decrease on the individual market. So that's how this is set up currently. But if you want to look at this, some people will say, if you're on the left, what does this do for the left? Because they want to take more federal money and put more people into the Medicaid market. But what I say is, if you want more people to be covered by health care, the best way to do that is keep the rates low. So if you look at the reinsurance, it lowers the current rate for those individuals that are currently not on the market or not purchasing on the market, so that they have a better chance of entering the market. If you're on the far right, you probably just want this whole program to go away. But that isn't happening, and we don't have the votes here in this room to do away with this program. And on top of that, if you do a reimbursement, if we can lower the rates, if we let them go up another 10, 15% next year, the people on the program aren't paying the difference. We will, because their max amount out of pocket is capped. So we'll be paying the difference. So when you look at this bill, you say, who does it really help? And that's the key to this bill. It's not for the far left. It's not for the far right. It's a bill that says the Wisconsin State Legislature understands we have approximately 216,000 individuals and families on the individual market in the state of Wisconsin. And we understand some of them are happy there. We understand some of them are unhappy there. But what it says is that we're going to look out for them, and we're going to do what we can locally inside the confines of the of the Affordable Care Act, and we're going to take care of them to stop and limit their increases and to give them more options in the market. But then there's one other piece of this bill towards the last paragraph that's just as important, and it says we are not going to stop there. It says on page 13, section 4, by December 31st, 2018, the commissioners shall submit to the governor recommendations on implementing a waiver under state statute 601-831B and any possible additional waivers to be requested and any option to stabilize the individual healthcare market in this state. And at that, we will both open it up to any questions you may have.
Well, thank